the problem that we're really trying to solve around emotional incapacity.
And what I think is very interesting is you took that knowledge that you kind of developed from the offline world, right? Because this was very much your impetus of this, your inspiration was like working with people, like human to human.
Very much.
Right? And then now you've kind of looking at how do you scale that into using technology and science.
Love Out Loud philosophy, we really look at increasing someone's emotional capacity means increasing their ability to have difficult conversations, increasing their ability to face challenges, increasing their resilience. 12 years ago, it really was a mainstream way of looking at mental health, I think because of our own internal resistance to want to take responsibility for the emotional parts of our human experience.
In a way, you're using that technology to act as that mirror.
It's a mirror.
So that the person has an opportunity to develop their self-awareness.
Yes.
And because in a way, like that's, I think, what a lot of even sort of spiritual, like great spiritual teachers often say, right? Is that like what you're experiencing is essentially just they're acting as a mirror to reflect the state. And so we project that onto that individual. They reflect it back in such a way that's transformative.
Basic things, that we know in longevity: sleep, good diet, exercise, fundamental stress management, healthy relationships, feeling safe to talk about our emotions, what we're going through. All of these things are going to play a huge role, inevitably, in someone's overall sense of well-being, but it was really rejected.
80% of Americans are afraid to say what they really think publicly.
100%.
So you're saying that fact, that single fact, is essentially detrimental to the mental health of everybody who would be in that position, feel in that position.
And the transformative nature that you see when someone can actually feel whole in their humanity, not be rejecting parts of their experience, and then be received, by another person or a group of people in that state is incredibly healing.
If you look at the cycles of, business recessions, you're right, it kind of ends up like there's a bit of a tidal wave of like companies that get washed out, but the ones that actually get started during that time because they have to operate so lean end up becoming those unicorns.
Love Out Loud didn't start with technology in mind. It started coming out of my 8-year career in mental health and realizing actually the work I was doing, the message that was at the core of so much of the work I was doing was really fundamentally every person wants to love and be loved.
All right, so we're here with Nicole Gibson from Love Out Loud, who has become an amazing colleague and I hope even a friend at this point, working together on a number of very interesting projects. And I'm going to take some time here to get a little bit deeper into some of the work that Nicole's been doing with Love Out Loud and then how it connects to In Truth, because that's something I'm still learning as I go as well. So you obviously started in Australia and now brought this to the US and are doing multiple things here. So maybe we start with that part of the journey. How did you end up coming to California?
I mean, how does any founder end up coming to California?
Right.
Elias, it's a total pleasure to be having this conversation with you. And yeah, I think maybe the why is a really important kind of foundational piece that is so core to Love Out Loud and also In Truth. The problem that we're really trying to solve around emotional incapacity and what that really means in our world. Really looking at some of the major challenges we're facing globally through the Love Out Loud lens and the Love Out Loud philosophy. We really look at increasing someone's emotional capacity means increasing their ability to have difficult conversations, increasing their ability to face challenges, increasing their resilience. When you look at rates of stress and mental health challenges in our world, the sort of major fundamental changes we're going through as a world and have been navigating over the past few years, emotional resilience, emotional awareness, emotional intelligence is so core to what humanity are really needing in order to thrive during this time. And you and I share this passion for human flourishing.
Right.
And so often emotional health is just this major kind of gap in the health conversation. Now, Love Out Loud started as a book that I wrote after working in mental health as an entrepreneur and also a federal commissioner advising the budget, creating budget recommendations in the government in Australia, and just recognizing 97 cents of every dollar spent in the Australian mental health system, similar in the clinical health system, is going towards crisis intervention. And the really confronting thing about that at the time, when I started to see and have visibility over these statistics, was the problems were getting worse every single year.
Right.
And my background is as an entrepreneur, right? So an entrepreneur looks at that, and it's like an entrepreneur's worst nightmare. We're investing in a solution that's actually, making the problem worse. And what are we going to do about that?
And what I think is very interesting is you took that knowledge that you kind of developed from the offline world, right? Because this was very much your impetus of this, your inspiration was like working with people, like human to human.
Very much.
Right? And then now you've kind of looking at how do you scale that into using technology and science and all of these things. Like how did exactly that transition happen when you recognized, okay, this is obviously a problem, right? And you were getting this problem by working with people in the community.
That's right.
And then you decided, okay, well, there's only so much you can do person to person. So you decided to look at how to scale that. Tell us a little bit about that process.
For sure, yeah. So to give a bit of context to what you're saying, my first organization was a mental health charity, and the approach was community capacity building and development as a way to solve the mental health crisis, which 12 years ago was considered this kind of really radical idea because no one really believed that there were environmental or cultural reasons for the mental health epidemic.
Can you restate that again? I think people are going to, I think that's one of those moments where like it's so important what you just said, it's just going to kind of pass over. So what exactly, restate that and what does that mean?
And thank goodness the conversation has evolved since then, right? But 12 years ago, it really was a mainstream way of looking at mental health, I think because of our own internal resistance to want to take responsibility for the emotional parts of, our human experience, whatever, wherever that has come from in the kind of Western culture. I think this kind of falsity around a lack of vulnerability meaning strength, which is the opposite of the truth. We're afraid to kind of show or reveal our points of vulnerability, which has created this culture where I think a huge amount of people feel expectation and pressure and don't feel safe to really be visible and seen, which as tribal beings is fundamental. We need that. And my work in approaching mental health in this way was, a huge amount, like 90-something% of mental health diagnoses are considered moderate to mild, right? Very, very few are considered acute or chronic. And so looking at that, of course, things like basic things, that we know in longevity, sleep, good diet, exercise, fundamental stress management, healthy relationships, feeling safe to talk about our, emotions, what we're going through, all of these things are going to play a huge role, inevitably, in someone's overall sense of well-being, but it was really rejected back then. It was kind of like if you have a diagnosis of anxiety or a diagnosis of depression or whatever it is, it's really going to be this kind of lifelong black dog that you battle.
Right, or it's potentially a serotonin imbalance or a biochemical imbalance. And so,
which is true, but there's a lot that can be done about that. But no one was having that conversation. And where do you begin?
Well, are we having that conversation though, Wes, is the question, because, I saw some surveys recently that right now in the United States, at least where this study was conducted, 80% of Americans are afraid to say what they really think publicly.
100%.
So you're saying that fact, that single fact, is essentially detrimental to the mental health of everybody who would be in that position, feel in that position, correct?
100%, because it's like, the work I've done with people and really the amount of humanity that I've seen doing this kind of really intense facilitation work from a young age, holding people in the deepest shame, the deepest guilt, the deepest regret, the deepest pain, the highest joy, all of it, has been a big part of my life's work, is creating a space where people feel safe to kind of put it on the table and really be honest about what's present for them and the transformative nature that you see when someone can actually feel whole in their humanity, not be rejecting parts of their experience and then be received, by another person or a group of people in that state is incredibly healing. And you notice the the taxing nature of feeling like we have to edit and audit and change ourselves, even slightly.
Yeah, to pretend to fit into the group, right? Where people are constantly trying to like calibrate, like who do I need to be to sort of fit into this environment and be accepted by my peers.
Yes.
And like you said, because we're tribal beings, I mean, that's actually a life or death program in our brain. So it's like, if I don't fit into the tribe, like I'm dead, I'm ostracized, and that could be the end of me. So we have that deep programming.
That's right.
And so I guess, how do you, with that knowledge that you developed from, that experience, working in government and then working in communities, then, like I said, now you are taking that into some digital, technosphere, right? Like, how does that transition happen, and how do you translate that? Because, knowing you, like, you're a very human, you're amazing human to human, but how do we take that and scale that into a more global community, which is what you've been working to do?
Absolutely, yeah. So, I mean, Love Out Loud, again, didn't start with technology in mind. It started coming out of my 8-year career in mental health and realizing actually the work I was doing, the message that was at the core of so much of the work I was doing was really fundamentally every person wants to love and be loved. Every person wants to be seen and heard. And the fact we're not addressing that societally means that whatever amazing, expensive, clinical, grand solution we put inside the institution that is health and mental health doesn't have the right foundation. So I really wanted to address that, and that's why I dedicated myself to writing the book, Love Out Loud, because I wanted to spend that time in kind of the philosophical exploration of the message. And I couldn't have known that Love Out Loud would turn into a movement. It had this quality about it. I guess the message was so it resonated with so many people that the book started to grow this global movement, which was one of the most amazing things ever, as a messenger, as an artist, to kind of know that your work is touching people and it's helping people put language to things that they feel. And even just that paradigm that Love Out Loud summarizes, which is really, out of all of the tens of thousands of choices we make a day, what if we were to simplify those choices down to love or fear? Expansion or contraction, to grow or be fixed. It really was a light bulb moment for so many people when exposed to that message, that I knew that there was something in it, but I didn't know the kind of the frame that Love Out Loud wanted to take to scale. I was also very passionate at that time, I think probably because of my work in government, recognizing that there needs to be more of a grassroots movement that was really going to shift the paradigm or kind of move the needle in the direction I could see was required, and I didn't trust that bureaucratic systems were going to get there fast enough. The
hierarchical approach, like it almost needs to come from the people and sort of maybe people even working with each other and sort of starting to change the paradigm from within, so to speak.
Exactly, because what you realize, working bureaucratically is you can change a policy, and policies do change all the time, but it doesn't necessarily change a human heart. And I think when you really see that in practice, when you see people giving 20-hour days in government to move a policy that they think is going to change the world, but then to have the contrast I did, which was on the other week, I was going back into communities that don't even watch TV. They're not aware of the policies that are changing.
Right.
It's not changing the level of kindness they demonstrate to each other.
Right.
That it puts things into perspective where you realize really the most powerful way to change your life is to touch a human heart. And I believe that, the deepest part of me. And Love Out Loud seemed to have that quality. It inspired people to change the way they were showing up in the world.
And so how did that connect into this idea of in truth?
So an education company started to grow originally from Love Out Loud, so events, education, training. And so that was kind of my taste of growing a business model that started to scale. And I started to become more passionate about scale and impact. And the work that Love Out Loud was doing in facilitator training and community-based consulting and development, and we were running retreats as well, gave me that kind of next level of maturity in my facilitation. And I started to see that you know, I was just convinced beyond doubt that it was so universal, the shifts that were happening in the space, regardless of whether it was a 13-year-old kid in a community in the middle of remote Australia or it was a corporate person in America, the change was actually the same. And that inspired me to realize it's so universal that the what if question became, what if we could create a technology that facilitated that same shift in someone?
So is it to facilitate the technology, or is it to quantify the change with kind of like...
No, the intent was, what if the technology could help facilitate the change?
Right.
Because then it was no longer on the shoulders of, you know, a group of individuals, but rather something that could be preserved and scale at an infinite rate. And what I started to, you know, facilitation for me is such an intuitive process that it can almost be hard to articulate, but essentially what I was doing with people in facilitation work was holding up a mirror, right? And the better I got at facilitation, the better I got at not projecting my bias or opinions onto someone and helping them have a space where they could see inside themselves. And I started to realize that self-reflection is the catalyst for transformation.
Right, so that's the key, right?
Yeah.
Is that in a way you're using that technology to act as that mirror.
It's a mirror.
So that the person has an opportunity to develop their self-awareness.
Yes.
And because in a way, like that's, I think, what a lot of even sort of spiritual, like great spiritual teachers often say, right? Is that like
Yes.
what you're experiencing is essentially just they're acting as a mirror to reflect the state. And so we project that onto that individual. They reflect it back in such a way that's transformative.
That's right.
And so you're saying, could we do that with a piece of technology?
Yeah, specifically emotion.
Right, so to really focus in on emotion. So tell us a little bit about how you know, decided to actually use some, you know, metrics and quantify them, which is currently where we are, right?
Yeah. I mean, Elias, I was in my first meetings, right, two and a bit years ago, literally typing into Google whilst on the call, what is an API? Like that was my level of technical kind of understanding.
Right.
But my core belief in the fact that it could be a technology was how universal it was. You know,
Right.
that
there has to be something.
There has to be something that can measure
that is like standard to humanity.
Yes.
That's potentially something
an insight,
that could be
a biomarker,
right.
something, you know.
Right.
But heart rate variability was not immediately obvious. In fact, I wanted it to be because heart rate variability was the most accessible.
Right.
So, you know, in the beginning, I actually I pursued a pathway to see if we could get the kind of metrics we needed to get the read through heart rate variability. But I had so many people tell me it wasn't possible. And I was a non-technical founder. So in the beginning, I was like, it's probably not possible. So I explored EDA technology, I explored EEG, but then I ran into problems around like, no one's going to wear a headband all the time.
Right.
So there was about 12 months of kind of deep exploration around how we're actually going to do this. And eventually, it was almost like an epiphany. I just had an idea at one point in the journey where I was like, well, if EEG has proven to effectively get an insight into valence and arousal, which is clinically the way emotions understood and measured, valence being positively or negatively geared towards something,
Right.
Arousal being pretty self-explanatory, how aroused, how much stress is in your body. When you put those data points together, if you're positively geared or positively motivated towards something and highly aroused, you're going to be excited. If you're negatively motivated but highly aroused, you're probably angry or somewhere around that. Low valence, low arousal, sad, et cetera, just for people to understand emotion in a clinical context. EEG is known to be very accurate at measuring valence and arousal. So then I just had an idea, what if we could use EEG as the baseline and collect heart rate variability data at the same time and just do an analysis around how much overlap there is in their ability to measure valence and arousal, knowing that heart rate variability is used as a metric for arousal, obviously, because it's measuring fitness, it's measuring sleep quality, these sorts of things. So how bad is it at getting insight into valence? And what if we could train a machine learning model off EEG data and teach the heart rate variability data how to get closer to an accurate reading? And in this idea, I was like, surely there's a whole bunch of holes in this idea, because I'm sure there's a bunch of things that I don't know.
Right.
But it just seemed like it could work. And so I put it to my tech team, and it was kind of just like it was like the clouds parted. And they were like, that would probably work.
Right.
And
we're going to find out now.
yeah. I mean, we've done a little proof of concept, and
right.
even with the data that we have currently, before we do the research with Prvun, we're now one deviation away from an accurate clinical reading.
Yeah.
So it seems to be a highly effective way of getting emotional insight. And it is really crazy. I think, right idea at the right time. You've got companies like Amazon Halo that tried to do it through completely different means, and it was through voice, tonality, and recognition. People didn't like it. It was too invasive.
Yeah, exactly. I mean, that was crazy. I mean, because I've been involved in wearables, for several years, and so when that Halo device came on, like my alarm bells around, privacy were just insane. But this is what I love about this sort of space of biometric science, because people don't realize how novel it is. Yeah. And so, like you said, even as an outsider, so to speak, to come in and say, well, what if this works? Let's try it. Like, there is that opportunity right now, because it's like, okay, how do we cross-correlate EEG data with this HRV data? Is there some type of a signal we can correlate between these two? Yes. And and obviously that's kind of what led us now to sort of, we're working to gather some of that data. I just literally came back 2 days ago from Brazil, where we were meeting the team there to get the EEG set up and get all of the technology in place to start doing that data collection. That's right.
Yeah, I really agree. And I think one of the questions that a lot of our partners and investors ask us is, this idea, now that it's on the table, seems so obvious. Why hasn't this been done? And I think, I know you get asked a similar question with Prvun.
Why isn't somebody, if this is so obvious, why isn't someone doing it?
And I think there's two answers that I've sort of thought of, and this is obviously speculative. The first is my non-technical background that was anchored in an obsession to understand the human emotional experience just was a certain lens that I brought into the tech space that maybe a more technical founder hasn't found themselves thinking about as much. They haven't dedicated their life to understanding human emotion. And so, the interest maybe just hasn't been there, because as you said, and I got a lot of this feedback when I moved into tech, people in my community and around me being like, what do you mean you're moving into tech? Like, that's not your thing.
Right.
Like, your thing
you're
is
like a human to human, like transformer. Why would you suddenly drop the technology into the mix?
So I think it's unlikely that someone with a facilitation or arts background or psychology background, not a lot of them become a tech founder.
I have to say, I actually totally agree with you on this, because my experience has been, in the space we're talking in, at least, most of the founders are either tech founders, scientists, researchers, physicians, who come in with sort of a pre-formed kind of way of approaching it, right, from their lens. And there isn't a lot. Speaks to the power of divergence. Yeah, there isn't a lot of polymath type thinkers, right? That's right? They're very narrow approach, and so I agree with you totally. And I think. But I also think one of the other things that I would say, to those investors and partners, also to the wearable space, is still so new. Like I said, I was one of the very early adopters, and that was like 6 years ago, right? Yeah, so that's right. And even then, the sensors weren't quite good enough to do a lot of what we're doing now. Like literally in the last 2 or 3 years, have the sensors finally gotten good that we can actually say that they have some level of clinical grade accuracy. And we're still refining those, we're still refining the algorithms. So really now is the time where these things become possible. Hardware's expensive. So a lot of hardware companies that maybe could create the breakthrough potentially don't make it. I think that there's a huge amount of reasons, but to your point, I think it's really
it's a very exciting time for companies. And I want to kind of stress this because I think a lot of founders, whatever space you're in, you know, based on kind of your background on paper, can be afraid to take on a challenge. And I think often it works the other way, like the differences when going into the unknown, the differences of thinking and background can actually become your biggest advantage if you back yourself in that. And I think we're at an interesting time now where, like startups are going through a pretty hard time. And I think the companies that make it through this time are really going to be the next unicorns. And I think that's a very compelling, like that gets me out of bed in the morning.
Same here. I'm 100% with you. And if you look at the cycles of, you know, business recessions, you're right. It kind of ends up like there's a bit of a tidal wave of like companies that get washed out. But the ones that actually get started during that time, because they have to operate so lean, end up becoming those unicorns.
That's right. And you're looking at the next generation of problems that need to be solved before the collective are kind of aware that they want to solve those problems. And it's a really exciting place to be. And I think partnerships, you know, so the relationship Prvun and Love Out Loud have established, I think that's key. Finding aligned partners, not trying to do everything, but have an ecosystem of people that are specialized, focused in the area they want to excel in, and working together, you know, to find those points of strength. I mean, I feel so blessed. I'm an Aussie founder from the Gold Coast. You know, and I'm a female. Like statistically, I'm in a very unlikely situation, and I count my blessings every day for that. And I think it also speaks to the power of the people I have around me that can support and build this with me every day. I think it's an amazing story that we're writing, you know.
And you know, and we're so honored to be working with you as well, because we're also very passionate about this. Obviously, my co-founder is a neuroscientist, and so he really loves the idea of how we're developing this, and we do appreciate what you bring so much to this. And as you said, we're building that ecosystem among those different founders of all these startups and working together, because like you said, it's kind of lean times, but that makes for that opportunity for those partnerships and those collaborations to really be very meaningful.
That's right.
And we can see each other through the challenges we face.
100%, yeah. Emotion as well. So often people think that emotion is this really subjective thing. And speaking of neuroscience, it's what's been really interesting for me in this journey and learning from the amazing, scientific advisors we've had on the project is emotion is not as subjective as we think it is. It's actually the millisecond response that we have to the environment around us. And I think that that's kind of really interesting to note in how this research is being conducted too, because it's emotion's actually it's more objective than people think it is.
Right, and it can be measured. It
can be measured, yeah. Feeling, like through a neuroscience lens, you've got the emotional trigger, which happens in 0.2 of a second, and then once you stay in that emotion for a few seconds, and you've assigned some kind of subjective meaning or a story to it, it becomes a feeling, and then a feeling becomes a mood, and a mood becomes a state of being. But that emotional state, which governs 80+% of our decision making, for the most part, it's involuntary.
I love that you brought this up, because this is something that when I first learned and I really kind of understood fully, it was just mind-blowing, because what actually happens is you actually have a response.
That's right.
And then the part of our thinking brain, right? Yeah, the part of the neocortex where we actually make meaning.
All of your beliefs, your
it
past
creates
experiences.
A story to justify the emotion you felt from an instinctual level.
That's right.
So it's actually your instincts that are driving your thoughts, not that you're thinking and then having the emotion.
It's just the ego loves to take credit for it all.
Yeah. So it's actually you're making that. So it's definitely an interesting thing about being a human.
Yeah, it's super interesting, and I'm looking forward to kind of seeing the results across cultures as well. One of the things that is really interesting to me about our project together is we're going to have at first Brazil and then the US to look at the cultural shifts in how people experience emotion, and then hopefully it's every other continent, every other culture that we do thereafter.
Well, good science requires a large data set, right?
That's
so we're just going to go for that, and so really excited to see where this goes. And for those of you watching here, just keep an eye on this amazing individual, because definitely you're going to hear a lot more from Love Out Loud, and also to the Emotional Health Project that we're working on together. So excited to continue with that.